Good afternoon. I'm Kathy Moore, your Public Health Director for Muskegon County and the Health Officer for the jurisdiction of Muskegon County. I want to thank and welcome the Region 6 Healthcare Coalition Lakeshore Partners for joining in on this communication update designed to support our residents along the lakeshore of Region 6, which includes Mason County, Muskegon County, Oceana County, and Ottawa County. The Region 6 Lakeshore Hospital partners are Holland Hospital, Lunnington Hospital, Mercy Health Muskegon, Mercy Health Shelby, North Ottawa Community Health Systems, and Zeeland Hospital. We had set aside time for an update from each of the counties, but as you can imagine, they are working diligently on other aspects of the response. We do have a recent update from the state of Michigan of the overall confirmed COVID-19 cases. Yesterday there was 110. Today there are 336 confirmed cases. This is not a surprise for us, as there were a backlog of tests awaiting results. So of the 336 confirmed positive as of today, there are 0 positive in Mason County, 0 positive in Muskegon County, 0 positive in Oceana County, and the 1 positive of Ottawa County that was reported previously. You can visit your local county health department website for the latest update. Again, the situation is constantly evolving, so it is important to note the date and time stamp of the information provided. As of today, Thursday, March 19th, Muskegon County has 0 confirmed cases. We have submitted 28 tests and received 4 results, all negative. However, it is reasonable to anticipate an eventual confirmation. To slow the spread in our community, it is critical for the public to comply with public health orders and practice common sense precautions. Our website, muskegonhealth.net, is updated daily. At this time, I'd like to introduce Dr. Jerry Evans, Medical Director, Region 6 Healthcare Coalition.
Thank you, Kathy. Appreciate that. Thank you to all of our partners who have joined us from the Lakeshore. I know that there is a lot of information being shared throughout every day, and we know how important it is to bring information to our communities as well as our partners. Let me share just a quick overview of Region 6 Healthcare Coalition. Michigan has 8 healthcare coalitions. Our region is Region 6. We cover 13 counties here in West Michigan. Our role as a healthcare coalition is to work with our local hospitals, EMS agencies, health departments, and supporting healthcare agencies to deliver coordinated and effective care during healthcare emergencies such as this. We help plan and coordinate resources among all the providers in tandem with the state Michigan Department of Health and Human Services. This includes tracking and coordinating on emergency pharmaceuticals, supplies, hospital bed availability, and other matters. All Michigan regions are following the state health department guidelines, which are updated on an ongoing basis. We also adhere to the CDC guidelines, which not only help each of us as individuals, but they also recommend protocols for interviewing patients, assessing the symptoms, and then making sure everyone is directed to the appropriate level and place for care. Region 6 also is responsible for distributing the Strategic National Stockpile. We received a shipment late Monday evening, and we have distributed most of that to our hospitals and partners. We had 15,000 N95 masks, 48,000 surgical masks, 1,900 face shields, and 700 gowns in that shipment. This is only the first of many shipments that are anticipated. I can't tell you when the next one is coming in. We don't know that yet, but we should know in the next few days. Now let me introduce Dr. Justin Grill, Chief Medical Officer of Mercy Health Muskegon, to share some brief guidelines on care at home.
Thank you, Dr. Evans. One of the first things that we are requesting of people if they're feeling ill is to simply stay home. If you don't have any chronic medical conditions such as diabetes, cancer, heart disease, congestive heart failure, or chronic obstructive pulmonary disease. You can do simple things like drinking water or taking Tylenol for fever. We are also asking people to stay more than 6 feet away from the nearest other person. If you believe that you've been exposed to COVID, or if you have a chronic medical condition, we're asking you to call your doctor, have a telehealth visit, or you can call a regional hotline. If, however, you have cough, fever, and significant shortness of breath, you should go to your nearest emergency department for evaluation or call 911. If you do not have a doctor, there are hospital support phone lines that have been set up. These will be posted on each of our partner hospital websites, and you can go there for further instructions. We thank you for taking the time for listening to this today and hope that everyone's able to stay healthy.
Thank you. We have a lot of information that is on our websites. If you go to myregion6.org, you can find some information there for the region. You can also find information on all of our hospital websites in the region. Now, we talked about the 4 lakeshore counties that we were working with right now for this statement, but we, as Region 6, we work with all 13 counties and all of our hospitals in that region. So if there's any questions, feel free to go to our website and go to our hospital websites and find out further information. If there are any further questions, we can take those at this time.
What was the number of tests that have been done so far? I know you guys don't have it. What's the number?
I will let Kathy address that. We're going to each be stepping away as we answer questions.
So the question was the number of tests for Muskegon County that's submitted so far. This in our state database is 28. We suspect that there are more tests that have been completed and filled and sent to the state, but the state hasn't caught up with the notification in their system to the local health department.
And of those tests sent, how many do you have negative results on?
Of the 28 tests, we have 4 results, and all 4 are negative.
Do you have enough testing equipment to meet demand, or is that, I know it's an issue for everybody, isn't it?
You know, we anticipate that there is a shortage, and that is why we are asking for the residents who are at most risk to be tested. So the state has followed the CDC guidelines and recommendations, and there is really strict criteria on who qualifies to be tested.
With so many lakeshore communities, has there been any thought at this time about what's going to happen with the beaches when they open? Is there any thought about whether you're going to close beaches or anything like that at this point?
There has been discussion so many times, because this is evolving every day. A lot of times we'll come up with a local plan or a regional plan, and the governor is also discussing the same thing, and so her executive order would come out, and we would shift our recommendations to follow the governor's executive orders as well as the CDC guidelines.
So at this time, the beaches are not?
At this time, the beaches are not on the radar for closure.
And who's actually doing the testing here? Who is it? Is it Hackley or who's kind of actually doing the testing?
Dr. Justin Grill.
So at the current time, testing is being completed at 3 locations within Muskegon County, at Hackley Hospital's Emergency Department, Mercy Hospital's Emergency Department, and outside of the Mercy Emergency Department, we have a testing station set up that's for use, that if somebody calls their primary care physician, as I talked about before, and they turn out to be a high-risk patient for COVID, as Kathy had noted, that we would want tested, that the state would want tested, they can actually be referred to that tent. It is not at this time a drive-up testing station. It does require a referral from a physician.
Any others?
Great. Great. If there are no more questions, I do want to recognize our partner, North Ottawa, who is also on the phone. And I want to thank all of you for joining us for this update. Please remember that this situation is constantly evolving. You can access the latest COVID-19 update on your local county health department's website. Thank you very much.